Good afternoon. I'm from an organization called DMI, or Earthquakes and Megacities Initiative. And my presentation will talk about our experiences in terms of measuring resilience, but resilience of cities. Just a brief background about DMI, we advance knowledge, policy, and practice of urban disaster risk reduction, focusing on megacities and complex urban metropolises. So we have done work for Mumbai, Dhaka, Kathmandu, Metro Manila, and Amman in Jordan. In all the cities that we've worked with, what we found out is that cities are really interested in terms of building resilience. But the question that always comes up to us is that, so how do we do it? Where do we start? With the limited resources that we have, where should our priorities be? So what we did is, the UNISDR did the 10 essentials, and the 10 essentials defined the parameters for making a city resilient, and we turned the 10 essentials into a tool that we call Disaster Resilience Index. It is a monitoring and evaluation tool for benchmarking and measuring progress or lack of progress on the mainstreaming of risk reduction and resilience approaches in the city's development policies and functions. So this is the concept. Essentially, it is inspired by the UNISDR 10 Essentials. And I think it is a very good tool that the UNISDR has done. But what we have done is to translate it for cities so that it becomes more functional for them, that they can use in order to develop their programs, develop their policies, and to develop their projects. So essentially, it is, they are divided into 5 sectors. We have legal and institutional, we have awareness and capacity building, critical services and infrastructure, emergency preparedness, development planning, regulation, and mitigation. So we've translated these 5 sectors into 10 indicators, essentially corresponding to the 10 essentials. So maybe some added value in terms of how the 10 essentials have been applied into cities is that for those 10 indicators, we have levels. We established some levels of sort of mainstreaming risk reduction in specific areas. 5 would correspond to full integration, while 1 is there's little or no awareness in terms of integrating risk in the functions and services of cities. The way we view resilience and the way we have worked with various cities is that if you talk of a city being resilient, you talk of a city that is able to provide services despite an event. For example, schools are still open, children can go to school even if there's a typhoon that's coming. Or the health sector is able to provide health services. People can go to work. So all these things, the services and the functions of the city, that they are able to perform, and that's how we looked at resiliency. And the way we have worked with cities is that we integrate risk within the health services, within social services, within the education sector, within the engineering sector, all the services and all the functions that the cities provide on a day-to-day basis with its citizens. And we have what we call indicator levels. 1 would be the little, and 5 would be the full integration of risk within the services and functions of cities. So we also, just to better communicate if cities are being resilient or not, we have what we call the resilience wheel. So this would be the bullet, the target. You have to be here. You have to be here, and this is color green when you talk about mainstreaming risk reduction in your services. So outside, which is color red, you have beginning capabilities in terms of integrating risk. But what we have done and what we have done with the 10 essentials is by taking it a step further. So, when you say that you are effectively integrating risk in your laws and your policies, we do not just accept it as such, meaning they rated themselves as 3. But what does 3 mean? 3 means these guide questions. Has legislation been passed? Do you have national legislation translated into an ordinance at the city level? Do you have a specific office set up in support of your legislation? Do you have the resources allocated for the office to function as such? So what we have done is to walk through all these questions, ask the cities themselves how they have been addressing all these questions, and then have them rate themselves from 1 to 5. In addition, we have, in addition to working with the stakeholders using those guide questions, we also have what we call develop a survey tool. And it's essentially, a tool that helps them assess where they are. In this particular instance, it involves emergency management. So if someone says that they are good with emergency management, what does it mean? Does it mean that you have an emergency operations plan? Does it mean that you have response planning that takes place all year round? You have a plan, not just a plan, but you exercise it, you update it, and you practice it? Are drills and simulations being done on a regular basis? Are others involved in terms of your planning exercises? So we walk them through all those questions, and after getting through all those questions, we ask them to rate themselves from very low, low, neutral, high, and very high. And this is what we have found out. In 8 municipalities in the Philippines where we have run this, you can see that these are the scores, but nobody is within average. Everybody is below average in terms of the ranks. What appears to be the major gap area is in emergency management, and they seem to be quite good at effectiveness of legislative framework, because in the Philippines, that we have a lot of laws, but oftentimes those laws do not get implemented. So it reflects it there. In addition to the municipalities, we ask provinces to rate themselves. So there's a difference between a province and the city in terms of their rating. The provinces would rate themselves lowest when it comes to risk-sensitive land use planning. But compared to the cities, they also, rated themselves very high in terms of institutional frameworks, which links with legislative frameworks. So this is just an example to illustrate their rating, and these are the provinces that we've covered. So those are the areas that we've covered, and they are color-coded, meaning the green corresponds to their specific rating. In addition to the Philippines, we did ACABA. In ACABA, compared to the Philippines, they rated themselves quite low in terms of the effectiveness of the legislative framework, but very high in terms of emergency and disaster management. But surprisingly, it's still below average. We did as well Mumbai. And in Mumbai, we worked with the municipal corporation. So in the first instance, we dealt with departments internal to the Municipal Corporation of Greater Mumbai. And these were the scores. And again, you will notice that this is below 3, which is below average. But the highest appeared to be emergency management, because they have set up their system already, or they have begun to set up an office and have been training people that are within that office. But they have concerns in terms of urban development and mitigation. In addition to those working within the corporation, we also ask, for instance, the state government. We ask private sector. Even from the nuclear agency participated in one of our stakeholder meetings, and they formed the advisory committee. So their concerns would the same with the corporation. It's about urban development and mitigation. And they rated themselves a bit high in terms of the institutional arrangements. Most recently in Metro Manila, we had a forum with the stakeholders from the various cities, from the 13 cities of Metro Manila. And prior to us running this forum, the office of, one government agency asked them if they're ready, and they said that from 1 to 10, we're 8. But when we asked them to go through all the details, it's below average. It's below 3. And these are the findings. In general, at the municipal level, the scores, as you have noticed, are below average. Scores increases with higher levels of government, for instance, provinces. And mainstreaming in development rated the lowest, which I think is becoming now a priority for the HFA too, that they say. And there is an astonishing consistency and honesty in the responses from all the surveys in the countries that we've worked with. But this is the most interesting. We did the DRI before we started the project with them, and what I've shown you is the result of the DRI after 1 year or 2 years of us working with them. But in the first instance, they scored themselves very high, meaning above average. But after working for a year or 2 with us, they scored themselves below average. What it tells us is that the more knowledge that they have, the more they say that, you know, resilience building, especially for cities, is not trivial. If you talk of land use planning and how do we make it risk-sensitive, you talk of building codes and constructions and how do you enforce it and practices, it's not really trivial. It's not that easy. You go through a lot of processes, bureaucracies, departments, talk to a lot of people, gather data, have the tools in place, and that's our realization. You know, when they realize what it means to be resilient, they realize that it's a serious job, actually. And let me just maybe highlight something that we've developed. We have developed a guidebook for others who may be interested to use the DRI tool that we have used in EMI. And this is a guidebook that we'll be making available publicly. It's a guidebook. It's a guide for measuring urban risk resilience, which brings together 3 different tools: the Urban Disaster Risk Index, Risk Management Index, and the Disaster Resilience Index that I've shared with you a while ago. We also have another guidebook. It's an Urban Resilience Master Planning. After attending some of the meetings being conducted here, and I think the thrust is on the how-tos, because HFA 1 is on what to do. Now we're going to the how-tos. And what EMI would like to share is our experience working with various cities for over 10 years now. We've did some master planning with them, and we'd like to share that experience with others, especially for cities who would like to make their cities resilient to disaster. So we're releasing this guidebook and making it available publicly. So that's it. A few of my colleagues who are present here, Dr. Bijan Kazai, Ann Siders, we have copies of the guidebooks or soft copies of the guidebooks in case you're interested. But otherwise, we will make them available through our website. We will be uploading our guidebooks, and essentially part of our mission is to share knowledge, to share the knowledge that we have, to share the experience that we have, so that other cities who may be interested in terms of making their cities resilient to disasters, then we have one of the tools among many other tools being shared here that they can access to. Thank you very much.